of people's perception on work and career and what that should be like and feel like. And so what we identified was, obviously at that point we'd got 4 generations in the workplace, and all these people come with a different worldview but are expected to work effectively together. And so the first thing we did was to sort of share with people, well, what are these different generational perspectives? So I'm going to share those with you now. And I'm going to do it in a bit of a fun way because it just helps for you to internalise the key messages. So, as we know, the state of the globe, very similar. We're all facing a growing challenge in relation to retention and the number of nurses to recruit. So we also have this group of people, like myself, called baby boomers, who were born between 1946 and 64, who are all coming up to retirement. And there's a heck of a lot of us across the globe. So as well as our problem with bringing new people in, we've also got the problem of how do we keep our more senior professionals, as in age, working for longer. So what about baby boomers then? So if you can just try and think of somebody that you know that might be of that generation that you work with, and see if you can relate to any of these. So known to be extremely hardworking, very adaptable and resourceful, but a bit of a workaholic, often to the detriment of their social life. So, you know, these are the people that will tend to work after hours, at the weekends, don't take their holidays when they probably should, and kind of through their professional career, their work has defined them, given them self-worth. They've got a bit of a rebellious tendency, so they will challenge a lot. Now, I've got a theory about this, and that is it a rebellious tendency, or is it that they're so close to retirement they just don't know what to say anymore, and they're going to tell you what they think, whether you like it or not? But speaking as a baby boomer, I think it's probably a bit of both. They're very motivated and driven by their career and progression. So, you know, titles and progression in terms of salary. But I think the main thing with them is this imbalance, this normal imbalance between work and family life. So just try and remember that as I go through talking about other generations that may be not so keen to have that imbalance. So the next generation is Generation X. So these are 65 to 79. And interestingly, they became known as the latchkey kids. And the reason for that is that the majority of them grew up in the 1970s, where mums in families started to go out to work. Divorce tended to be on the increase. So they learned to be independent and stand on their own 2 feet quite early in life. So think about people who might be of this generation that you work with. They're often now, you know, mentors, they're supervisors, they're managers. Now, the thing about these people is because they're very self-reliant and independent, they do the team thing, but their natural preference is just to get on and do it on their own, because they think probably it'll be quicker and I'll probably get it right anyway the first time. And they tend to like clear direction and instruction. So what is it you want me to achieve? But they don't like to be micromanaged. They don't like people to keep checking in on them and what they're doing. So they kind of don't need lots of checking in. They're very innovative and adapt well to change. And we're often entrepreneurial because in society we started to see through the 1980s that encouragement to focus on self and be entrepreneurial and creative. They're very loyal to careers and employers. But I think the main takeaway for me for this generation, just remember they're a pragmatic individualist. So let's go on to Generation Y, because this is the generation we studied in the first piece of research, and I hadn't realised how different approaches to education had become in relation to what had influenced this generation as they were growing up. So 1980 to 1994, so known as the millennials. So most of you on this session are millennials, and I think I, as a baby boomer, can learn an awful lot from you. Because you were educated in a slightly different way. So I, as a baby boomer, was motivated by sheer fear, because if I raised my head, if I challenged, I would be put in my place, probably humiliated, bullied a little bit. So I learned not to do that, and I learned to try and get it right first time, because I didn't want the repercussions if I got it wrong. Whereas education's changed, hasn't it? So we now motivate by lots of feedback and recognition for achievement, which is a much nicer way to encourage people to do better. So if you think of a stereotypical mid-generation Gen Y, because remember, there'll be people who've got Gen X tendencies, and there'll be people who are younger Gen Ys that might have more Gen Z tendencies. But middle of the road Gen Z was used to getting lots of feedback at school and motivated by recognition. So, you know, you could come fifth in a running race, but you'd get a certificate, because actually that would encourage you to try even harder next time. Generation Ys tend to be very career motivated, but less company loyal. And what that means is they are hugely committed and hugely engaged and will achieve great things in an organisation, but they do want their employers to support them to succeed. So, you know, if you've been educated and motivated by feedback and recognition, and suddenly you go into the workplace and you don't get any feedback to tell you how you're doing, and you don't get recognition for your contribution or value, actually that can have an impact on your self-esteem and your confidence. So if a Gen Y's employer is not supporting that progression and enabling them to succeed, they're very brave, and they will walk away. And you know what the research tells us is they're more likely to change jobs if their needs are not met, but that they're more than likely to have one more professional career in a lifetime, which is something our Gen X's and our baby boomers would never dream of. You know, it was a career for life. But remember, as Gen Ys, you'll be working a lot longer. And of course, economically, we know that our current Gen Ys at the same age as our baby boomers don't amass the same wealth, you know, at the same time. So it takes a lot longer to achieve things nowadays than it used to, in terms of you know, setting up home, in you know, material possessions, etc., etc. But quite interestingly, Gen Ys are less interested in material possessions than they are life experience. And I think this is a wonderful thing, because it gives us a great opportunity. Very much team players. So know the value of a team and want to be in a team in the workplace, because recognising, you know, through education, often Gen Ys were encouraged to problem solve in teams, so that translates into the workplace. So everyone having a voice, everybody having a contribution, you know, recognising each person, no matter what their experience, brings a value to the table. So this want of a sense of community in the workplace and a work family. So I think summarising, it's kind of a working with you, not for you. Think back to our baby boomers who were a bit workaholics. I think Gen Ys have seen this model and are not keen to role model it. So reflect it. So prefer flexibility and actually want a bit more life balance. So absolutely want to work hard, but actually recognise that there is a balance to life, and to remain resilient, you have to also look to those experiences outside of work. And finally, I think in terms of retention, that Gen Ys have a great sense of purpose and the need to contribute to the greater good of society. And I think you'll see that through the growth in volunteering across younger generations, but also in elections across the globe. You can absolutely see this move to being a global citizen, which is absolutely fantastic. And then finally, the new kids on the block. Generation Z, 1995 to 2010. So relatively new in the workplace. But I think to understand these guys, what we have to remember is they are the first generation to have never known a world without smart technology. So that is, smart technology is having the world of information and knowledge at your fingertips. So if you need to solve a problem, there's pretty much nothing you can't find the answer to on YouTube, is there? And so that approach to problem solving is very different to previous generations. It's testing out from that global knowledge, what is the best way to do this? And so recognizing the value of that technology to achieving great outcomes in the workplace. But of course, if you're a baby boomer and you're not been used to having that smart technology, and you've got somebody working in your team that's got their phone or their device in their hand all the time, you might think they're being a little bit distracted, a little bit lacking in focus, and actually you might ask them to not use it. But you have to then question, are we disabling that person from being the very best they can be because of their preference related to problem solving? And again, open-minded and more tolerant of others. Now, this is the first generation that expect diversity around them and are true global citizens. We have yet to amass enough evidence around Gen Zs in the workplace, but watch this space. But I think, what you can see here is why sometimes there may be some challenges in working together in teams. You can imagine, can't you, if you're a Gen Y and you're used to people checking in and just letting you know you've done an okay job today and you did that well, so don't worry about it. And you need that. And you've got a Gen X who's very independent and has never needed that kind of checking in. And you could see they might think that was neediness or lacking confidence or competence, when actually, no, it's just my way of being the very best I can be. So although we are all different, we did a second piece of research, which I'm not going to go into detail of, but it's the basis of our ongoing conversation during this session. And that is what unites us. Because when we actually went on to look at all of those different generations and how did we ensure that they were retained in the workforce, what we found is there were some common principles, some common things that were important to all of us. It doesn't matter what age we are in terms of getting job satisfaction. So you can see some of those things for yourself on that triangle. But I just want to talk about things on the right, because I think historically, in our profession, we've perhaps focused on the things on the left and less on the right. But what the right is about is this absolute need for meaningful recognition, the need to be able to contribute, to have a voice, to have a value in the workplace, and to be recognised for what you contribute, to have the opportunities for education and growth and development as a professional and as a person. And then this notion of professional autonomy. So to be enabled to enact our professional role with a high degree of autonomy and flexibility, but also to be at the centre and front of decision making. So I guess to have more control over our own working environment and the way things work. So I'm going to move on because I'm just mindful of time. So we've got another poll, Hannah.
Okay.
Anna?
Yeah, I'm here.
Okay. So I'm just going to ask people, because you'll all be from different nations. So can you relate to any of the traits described previously in some of the people that you worked with? I'd just be interesting to know the level of which you can relate to some of these descriptions.
So far we've got 75% of people say yes, they can relate. 25%. 25% say to some extent.
Okay. So that kind of ends my little part of this questions. But I think the ongoing discussion topic is about how do we lever these differences that have such value, and how do we work together to develop a positive practice environment that enables nurses and midwives to thrive and to excel?
Thank you so much, Kerry. And as ever, I always enjoy this presentation and can resonate with so much of it in so many different ways. And when I began the Nightingale Challenge a year ago, I knew that in order for it to be successful, it would be really, really important that the employers who we were asking to take real responsibility for investing and putting the spotlight on early career nurses and midwives, that we'd find people that really got the fact that it's okay to be different, and we're not trying to create more of us, but embrace different ways of working, different cultures and different approaches. And there's two real sort of role models that stand out for me, and one is Nicola Riley and Amina, who have got a fantastic mentor-mentee relationship from Qatar. And then we've got Grace and Harriet, who are from Uganda. And so really, I kind of like to hand over, we'll start, shall we, with Nicola and Amina, about what your take is on this research. And I guess really, what mutual benefits you see in working so closely together and breaking down these sort of artificial, in a way, artificial and real, though, intergenerational barriers. So over to you, Nicola. Oh, I wonder if Nicola's on mute. Are you on mute, Nicola?
Thank you for that. Thank you. So, good morning. When I first came to Qatar, the Health Minister, Her Excellency Dr. Hanan, had a very clear vision about focusing on the youth within the country, national nurse leaders to develop the identity. And I guess if we look at the country, we had 47 nations providing the nursing care, and a lot of the nurses here are young and had a lot of energy and passion. So a lot of what I've seen within your presentation this morning resonates with me, thinking about the generations we have here, the use of technology, and the sheer commitment in the youth, Amna and her colleagues. And I think, you know, in terms of reshaping, repositioning where nurses in Qatar are, particularly this young generation, it certainly resonates for me and some of the things that we've been doing. But I'd really like Amna to say something in terms of her thoughts.
Thank you, Dr. Nicola. Hi, everybody. It is really amazing opportunity for me to talk in this. Thank you, Lisa, for calling me for this. When we started the Nightingale Challenge in Geneva, it was the start of our career. Dr. Nicola, thank you very much for accepting the challenge and putting Qatari nurses in this. Since the day of accepting the Nightingale Challenge, a lot of things happened here in Qatar. We had two scholarships from Florence Nightingale here in Qatar. They delivered 2 leadership courses, and it was really amazing. Dr. Nicola, she developed more than 30 Qatari nurses during this time. And our work, I think, did not stop. It started from there. From after that day of our finishing our leadership and going back with a new experience, it was actually a good opportunity to us. And working with senior nurses like Dr. Nicola with all her experience, she put a pathway and a plan for all of us. She did not just put the plan and that's it. She put for us mentors. Everybody decide what you want to be, where you want to be, what you think yourself after how many years, 3 years, 5 years from now. And this helped me really to see the difference. From that day till today, I'm a totally different person in regard of my leadership. And I am very happy that we will continue until next July, correct? I don't have any much things to say but this mentorship and leadership, it's very appreciable for us.
Thanks, Amina. When we spoke earlier in the week, you talked about how the Nightingale Challenge, why you had to pause it with COVID, how that early leadership training really helped you to cope with some of the challenges that COVID was throwing at everybody. What kind of things that really helped you? What sort of leadership skills had you developed that gave you that strength to get through some of the really tough days that no doubt you faced?
We went out from that course with new networks, people. We developed our networks through WhatsApp, and I did not think that we will use it this much. And maybe this is the first time in Qatar we know all of each other now. We have a different Qatar in all the hospitals that we don't know each other even. And now I am sure that I know all of them. And we are working with each other during this COVID to facilitate the patient care, patient transfer, any new pathway, any things that started, any new like updates happened. It was really very helpful for us.
Brilliant. Thanks, Amina. And Nicola, to you, I think it's fantastic what you've obviously been doing. When we've talked, you've drawn strength from the early career nurses and midwives, haven't you? And I guess what have you learned? Because you get to a point in your career where you might think there's not that much to learn now, but you've learned so much, haven't you, by engaging with the early career nurses in a different way to what probably we've been trained and taught to do. And I think it's helped you in some of those, really challenging times too. Would you just share that with us, Nicola?
Yes, very much so. The appetite, the enthusiasm, and I think in terms of the innovative ways of thinking to resolve situations and problems, and giving that platform. As I say, I came with the mandate was to develop the youth. The appetite has been fantastic, and it's been very energizing, but it's also thinking, as you say, about the whole nursing workforce. I'm a baby boomer myself, and I think it's looking, and it's the resilience that's being built, and the leadership capacity and the appetite for it, and that genuine commitment, because it's, people might attend some development or go back to the workplace, but it's that, for me, it's that resilience that's developing. It is that commitment to continue to develop the agenda. And what has been really exciting, if we think of the management and the leadership of COVID, if I think of the facilities we've had open, a number of the category nurse leaders have, with coaching and support, been leading that agenda. But I think it's that commitment to the wider, as I say, all nations are important as well, 47 nations. It brings with it great opportunity, but great challenge. But to see the youth flourishing and coming through, and for me, it's the space for them to be able to do that. Because, it is about the engagement of all, but this group, the enthusiasm, and we did. Anna's drawn reference to 2 programs at the time. We also worked with the young assistant execs, and they went through RADA. So in terms of engagement with influencing in meetings or at boards or presenting at public events, it's building that strength in depth, really. But it's the energy that they bring to arenas. It's very refreshing.
Fantastic. Thanks so much for sharing that, Nicola. And again, you continue to inspire me. The other thing, Kerry, I don't know whether you found this in your research, was the respect that both parties have for each other. And when we get to Grace and Harriet, I think we'll feel and see that there. But the mutual respect for each other's challenges and positions, it's just smashed all of that hierarchy that we know in nursing can be quite prevalent and potentially damaging. Did you find that, Kerry, in your research at all? The hierarchical thing?
Yeah, and I think, do you know what? As you know, for a couple of years, I've kind of talked about this extensively. And in organisations where they just have an awareness, it changes the dynamics. And when it works really successfully, it's about valuing and recognising what younger generations bring to the team. So I've worked for years now with a Gen Y who I couldn't be in a team without her, because she's so quick in coming up with creative, innovative and she reframes all my thinking. She doesn't see the restraints that I perhaps see in my thinking, and I know we have achieved so much more because of that relationship.
Yeah, fantastic. And that's without the technology wizardry that I think sort of the Zeds are going to be bringing to us. They're fearless around tech, whereas I am still, kind of fearful. They're just intrepid, aren't they? In a sense, nothing is not possible, which I think is something really exciting to harness as we learn more about that group of people coming to the workforce. Now, I'd like to go to Grace and Harriet. How are you both doing on the technology front? I know we had some challenges earlier. Can you hear us, Grace and Harriet?
Yeah, we can hear you fine.
Oh,
we've given up on the 2 computers in different rooms, and social distancing has gone a little bit awry.
Oh, well. Well, thank you so much for persevering. So just a brief background. I was, again, really blown away. I was in Uganda in February. The Nursing Now board went there, and we'd connected with Grace and Harriet because they were doing a Nightingale Challenge. Harriet's a pioneering young midwife, actually, that works for the ICM. And Grace, she's at the Aga Khan University there. And I went to see the fantastic work that Harriet was leading with the mentorship and support of Grace. And we talked about the mutual benefit of different generations. I referenced your highlight work, Kerry, and just the power of what you two are doing, with communities in Uganda, for which some are really challenging. I think is just out of this world. So I'm going to say no more and let you tell the story. So Grace, do you want to start? And I'll leave you to see when and how you bring Harriet in.
Yeah, of course. So we're both together now, so you can see us. So it was great listening to Kerry's talk, me as a baby boomer and Harriet as a Generation Y, and me from high resource country, her from a low resource country. So I've been in Uganda for 4 years, and Harriet was one of my students, one of the first ones to graduate as a bachelor's midwife. And I saw the potential in her from the minute I met her. She's a natural leader. She was a class leader, and we kept in touch afterwards. Then she was elected to a global leadership program with the ICM and asked me to be her mentor. So it's been great for us, a great challenge, because I bring the experience, but she brings the cultural expertise. And we're both great believers in lifelong learning and working together. So we've learned so much from each other. So we have a very equal relationship. It's not teacher-student, it's very equal. She teaches me, I teach her, we learn new things together. And it's been very, very useful. So I've been able to help her develop her charity work, where she's looking at marginalised young women in the very poor community. She can tell you a little bit more about that. But what we did find helpful was the ICM used the Centre for Mentoring Excellence as a programme, which is quite structured, but we found it very useful because it helped us to both explore any baggage that we brought with us. And it's really helped us to make sure that we're really an equal relationship. Both of us contribute equally to the relationship. So I'll hand you over to Harriet.
Thanks, Grace.
Yes.
Hi, Harriet.
Hi, Lisa. Yes, our relationship, as she said, it started from her seeing me with a vision. It's very easy to meet a person who has a vision, and also learning the culture differences and values, and also respecting them as long as you stay with them. Because you cannot stay with people of different cultures and values unless you respect them. So we had to come to that level, and it came naturally. I understand her culture, she understands my culture, and we are not there to change each other, but to her to grow me. So
and me to grow, and you to grow me.
And she says, and me to grow her. I was really surprised when she said that she has learned a lot from me. I was totally blown, because at first I thought that her, with her expertise, I'm there to say yes, yes, yes to everything. But with mentorship, I learned that it's not necessarily to say yes, but I bring my ideas and she helps me shape them rightly. So that has helped me grow a lot. And then when you come to the work that I do, she saw it very important that I needed support. So she brings in her expertise and then that technical support to uplift me. It's not a relationship that where one comes and gives you money, no, but to help you grow and self-sustain yourself. That is what I'm gaining from her. The friendship has come naturally, where everyone feels safe to be close to each other. For example, right now I'm at her home and we are just enjoying. So if mentorship comes to this level, you benefit a lot. It's a mutual relationship. I really wish to sustain her as my friend, my advisor, and she feels the same. I can't imagine. So if all nurses and midwives in the world can be able to attain this kind of relationship, they can grow. That is starts from setting goals and also know what you want from your mentor. Yes, because I had to see what she has and she's able to give it away, because she can have it and not willing to give it, but she gives it to freely. And then being open, she knows all about me, my career goals, my relationships, and she's there fitting in my life. So that is alone to take us ahead. That I consider it as very valuable. And she's also working well with us together with the team at MILCOT. They like her because of her support.
Harriet, could you just tell us, I mean, we've got an article that's going into an African journal in July about your work, but would you just share how you have, I've found some funding, not only to support the young disadvantaged girls in the community of MILCOT, but how you've secured further funding through the partnership together to do more work on the Nightingale Challenge. Because again, this I think was really amazing. It just popped up out of nowhere, and you've got not only a really exciting program, but some really precious funding as well, which is not easy to secure these days.
Well, together with her support and advice, we have been able to apply for funding from Badet Trust for Nursing, and Badet Trust for Nursing has trusted us with the funding because of what we are going to do in the community, and she has been very supportive with it, writing proposals to see that we can really bring out the best out of it. And as I told you in the first session, our project is about building resilience of midwives and nurses in the community towards the effective and efficient preventive service delivery. So she has been very supportive, and she's going to be supportive, bringing the expertise even from the university where she works to be able to work with us to produce the best out of this project.
Brilliant. I mean, and Grace, is it just worth sharing, how much I know you're enjoying living and working in Uganda, but a lot of that has to do with your connection to Harriet and understanding how the cultures work and finding exciting things to do, and maybe just some of the work, because it is fantastic. I've seen it, how Harriet is leading, support groups for disadvantaged young girls that are vulnerable to all sorts of challenges, that don't get to go to school, etc. But how you've been able to do all of this, really, because in many ways, I guess, your connection with Harriet.
It is. When I first came here, I was very naive. I thought I was coming out as a baby boomer, to change the world. And of course, I was really shocked at what I saw in terms of maternity care. I work clinically as well as academically, so I was absolutely floored by how poor the care for women was. It's absolutely atrocious. So we have a maternal mortality rate of 336 per 100,000 compared to the UK's, which is 9 now. So I really wasn't prepared for that. But I haven't normalised that, and I don't ever think I want to normalise it, because there are so many things that we can change that are not cost-driven. And Harriet is a great example of that, because she's now uses evidence. She's very academically astute, as well as a very good leader. So she's developing those great skills. She's not just accepting the way things are, she's changing things. Yeah. She's a real change agent, which makes me so proud. And that's why I say I've learned so much from her, because she set up this charity. She set it up with her own money. She uses her salary to pay for, the rent of the room. And now it's starting to take shape and she's getting support. It's very well deserved, because the care for marginalised young women here is really awful. And as you say, they can be pulled into prostitution, pulled into, you know, abusive relationships. And Harriet is helping to build the resilience in midwives and nurses so that they can handle it better, so they don't accept that this is the way it is in Uganda. So she's really done a great job, and it's great to be involved in the whole project. And my husband's very technical, so he's been helping from a technical perspective. So it's great to see her grow and the project grow, and the care that she's developing for this very vulnerable group of women is just humbling. It really is. Yeah. So it's been a very good experience in that way.
Great, thank you so much. Any questions maybe from Kerry? I mean, Kerry, you've done a lot of international research and travelled around a lot, but probably like me, mainly UK based in terms of our healthcare delivery on the front line. Any sort of thoughts from you, or ideas or reflections that you want to share?
No, but as a midwife, I'm blown away by the story told. I'm feeling quite emotional about the power of.
Yeah, I feel quite emotional now.
and equally of both these relationships, because I think for me, what it demonstrates is, whilst we focus on the difference often, when we get it right and we appreciate and we recognise the value of each other, both from a generational but also a cultural perspective, what can we achieve as professionals? It's incredible, isn't it? Absolutely incredible. So I suppose the reflection is, how do we promote and scale this up? Because I think we are now global citizens, aren't we? Challenge has shown that. And I do think younger generations recognise that more than previous ones. So to be able to leverage that to face some of our global challenges, both in relation to our patient outcomes and patient experience, but also our staff experience, phenomenal.
Yeah, thank you. I mean, I truly believe we, as often with things that, you start that are quite brave. I didn't know where the Nightingale Challenge would go. I can't believe we've got nearly 30,000 people in so many countries. The wonderful conversations I have, and the people that reach out to say, how can we do this? And then being able to connect people with people like Grace and Nicola and Harriet and Amina. I do think we're onto something, and I think that my real drive now is to sustain it beyond next June and find a way to continue to evolve this, because I do believe, and we'll talk more about our global solutions launch later this afternoon, but I do believe that this global community can be the solution to so many challenges that we face. We've just got to support, empower, and enable conversations and relationships to flourish. And I feel that Nightingale Challenge is a little bit like glue. It's helping. It's absolutely not about telling people what to do or how to do it. It's connecting, sharing, inspiring, and almost being there as a bit of a safety net. And particularly through COVID, we've put some webinars on, and they're simple things in many ways about compassion or what's happening, health and well-being, but it's just that time out almost. But for the community that's so, although global, like-minded, I mean, so often the challenges are very similar, dependent upon what country you're in. So for me, Kerry, in terms of that scalability and sustainability, I do believe there's a massive opportunity through this initiative, if we can sustain it and find ways to sustain it, which we're currently working on, to keep this going, because it could be a fantastic, global community that can be the go-to place to help retain nurses, recruit nurses and midwives, and also, hopefully for serious decision makers to come to, like the Director General from the World Health Organization, like key decision policymakers. So there's lots more that we're trying to do to raise the profile of the early career nurses, the sheer size and volume, but all of the energy that comes with it. But we do also need those other generations to be right behind them and not kind of inhibiting them. So I just want to say a huge thank you to you all. We've got actually just 5 minutes if there's any questions in the chat box. Hannah, I don't know if you've been looking at the chat box or if there's any any questions or anybody would like to ask a question to this formidable panel, you'd be very welcome to. So I'll just have a look down.
Yeah, we've got lots of people saying great to hear about the relationships and that, you know, mentoring is key. Lots of support.
Yeah. Brilliant. And I think that the networking, I think, Camilla, I think the network is one of the most powerful things we can do next, which is what we're hoping the Global Solutions Initiative will start to do. We'll network like-minded people with like-minded problems to come up with the solutions. So I do think it's so exciting, and a huge thank you to you all. It's been a real treat to spend this time with you, and look forward to continuing the relationship as we move forward. Thank you all so much, and I hope you enjoy the rest of the conference. Bye-bye.
Thank you. Bye.